Hello, Dr. Khairul. Thank you for being on the
Hi.
show. I've invited you to come on the show because we want to talk about what the world is facing today, and I was hoping to talk to someone who has a knowledge of what the frontliners face. So why don't you just give an introduction for yourself?
Thank you, Justin, for having me. My name is Dr. Khairul Azri, and I am an emergency physician. So I specialize in emergency medicine. I'm working in the Department of Emergency in University Malaya Medical Center.
What I've always wanted to know, staying at home here, I have no idea what's happening in the hospital. I'm only imagining. I'm only imagining like how hard, the jobs of medical professionals are now that we have this pandemic. So take me through.
Sure.
What's happening in hospitals right now that receives COVID-19 patients.
Sure.
What is it like for them?
Okay. So thankfully, I'm not in a hospital now. As you can see, I'm at home. But I will share with you a little bit of experience, probably specific to UMMC practices. Being a university hospital, we are a little bit different from the rest of the KKM hospitals. So first of all, I want to say that it's not just the COVID-19 designated hospitals who are dealing with this. The entire health service in Malaysia, and of course, across the world, has to deal with potential COVID-19. So even if your hospital is, or your clinic or your health office is not dealing directly with COVID-19, you still have to prepare yourself with adequate knowledge, safety practices in order to recognize and be able to initially manage and then transfer these patients to a COVID-19 facility. So as you pointed out, COVID-19 facilities such as UMMC, we are dealing with COVID-19 patients at the front door. Some of them have come in asymptomatic, some of them have come in with just mild symptoms, and some of them have come pretty unwell, requiring aggressive treatment, requiring resuscitation, and these are the things that actually put our frontliners at risk. So let me just introduce to you who the frontliners are. So I work as an emergency physician, so I'm a specialist, and whenever I'm on duty, I have a group of people working on the floor. And as you know, the emergency department is 24/7. We don't close. We're the only department in the entire hospital that doesn't close. On the floor, we have the main strength of our service are the emergency nurses. So the nurses make up the bulk of the service. Then we have our doctors. So we have our junior doctors, our trainee doctors, that's our house officers. We have our medical officers, and then we have our specialists, and then we have our consultants as well. So at any one time, and not to forget our medical assistants, our attendants, and also our cleaners and our food delivery assistants. It is in this time that we see that group effort and the role played by every one of those that I've mentioned is so important to how we function. I would like to reassure you and tell you that we are so thankful that in these times, everyone is playing their role so immaculately that everything is thankfully under control. Everyone has been designated the right jobs, and everyone is committed to carrying it out. And it is with that teamwork that it works seamlessly. So what must be running through the minds of our frontliners? So our nurses, our MAs, what do they have to do? So firstly, they must be worried about what the disease is. So we've taken the step to educate them first and foremost, to tell them to not take for granted that you're working in a hospital, automatically you know about this disease. Yes, nurses, MAs, doctors, we have fundamental knowledge about healthcare. But then again, this is a new disease. So we tell our staff, hey, this is a disease that's very easily spread. But it spreads only via droplets. So these are the type of precautions that we need when we deal with a particular patient. So we tell them that with this disease, you always have to now wear a mask, okay? Because even if the patient can wear a mask, that's one of the first things that you do. You put a mask onto the patient. And then if you wear a mask and you maintain 1 meter distance, we tell them, you know what, that's already enough to protect yourself against COVID-19. So all your other treatments can go on as long as you maintain that standard. But if you need to touch the patient now and you need to provide some kind of treatment, then your level of protection has to be increased. So we tell them, okay, they need the gown, they need to change their mask, they need to wear a face shield, they need to wear gloves. Why? Because as we've discussed, it's spread via droplets, and if someone is coughing actively at you, you need to protect yourself. It's called a splash precaution. So whenever we're dealing with bodily fluids and things like this, it can land. So because it's droplets, it's not airborne, it follows gravity, so it will fall and settle on the surfaces. So we tell our healthcare workers, don't worry, whatever that you're wearing, if you're wearing it right, that will protect you. But it's more important that after you're done, that you need to be able to remove this protective gear in the right way. Because if you contaminate yourself when you remove it, then there was no point of you wearing the protective gear in the first place. So we teach them how to don and doff. That's the technical term for it, donning and doffing of the personal protective equipment. They remove the dirtiest part first, so they remove their gloves first with minimal touch, then they put it in the bin, they clean their hands, they remove the shield, they clean their hands, they remove the gown, they take care not to touch the front of the gown, they roll it into a ball, they clean their hands, then they remove the mask, they clean their hands. That's a very simplified technique, but as you can probably tell, just by knowing that those steps and those precautionary measures are there to protect their safety, that's one of the first few things that's going to reduce the amount of anxiety and fear among our healthcare workers. Knowing the enemy that you're dealing with, knowing the weapons, that we already have the steps that we already have in place. You're not just trying to protect yourself from the patient. Our practices, daily practices in hospitals also got to change. We can't go to the pantry and crowd anymore. We can't share the same prayer area, prayer mat anymore, because these are the places that can transmit disease very easily because they're communal spaces. So we've got to change our practices. So we do a reminder for them. We have announcements. We have posters to remind them about all this. But most importantly, we tell them what to do if they feel they've been exposed. So there are a number of ways. So of course, the example I've given you is that they can get the infection from the community. They come in one day and they feel unwell. They have body aches, they have a little bit of sore throat, and they feel a bit feverish. So we've told them that they have a responsibility to actually highlight to the, in fact, they need to report to the head of their department if they are unwell, to get clearance for work. So I hope this is a reassuring matter for the general public, because we screen all our staff who come in to work. And if they are unwell, they are told to contact our OSHI department, our Occupational Safety and Health department, who is in charge of staff and the safety and health of our staff. And they will do a risk assessment. Usually they will ask big questions like, have you treated any COVID-19 patients recently? What kind of a PPE were you wearing? What kind of procedure were you performing on that particular patient? More importantly, as we've discussed, how did you take off your PPE? And what kind of symptoms are you having? So based on that, the OSH department are doing a great job, I believe, in every hospital, every health institution right now, to assess the risk of all the healthcare workers. So they identify if they are actually low risk in that they wore the right PPE, they did all the right steps, or they are moderate risk. Maybe there was a breach in the PPE, something was not worn correctly, or different thing was worn, or they were high risk in that maybe they weren't aware the patient was even COVID-19 and they didn't have any protective gear on, and they had very close contact. So close contact is defined as less than 1 meter, more than 15 minutes. And of course, the condition of the patient, if the patient was coughing actively and things like that. So there's always that fear that you fall into one of these categories, so either low, medium, or high. And if you are deemed to be high risk from something that may very well not be your own fault, but in the way some patients have come in, and this is true, having not declared that they have been at a gathering, denying when we asked that they have close contact with someone who's positive. They only tell us a few hours later. So if we do fall into that high risk category, which does happen, and we've had our frontliners fall into this category, they immediately fall into a high risk whereby the hospital doesn't take any chances. We say, okay, let us assess you, but you have to stay home for 14 days. You have to quarantine yourself for 14 days. Even we're going to swab you, we're going to do a swab on day 5. But even if your swab is negative, we don't want you to come to work because you are categorized as high risk. And that's where it starts to set in. And that's where I see my staff very significantly emotionally affected. And it's multifactorial. It's one that you're so affected by the fact that you might now be infected with the disease. Then comes the second worry. These people have families and they have to go home. And if they are positive and they've been told to quarantine themselves for 14 days, are they then at risk of transmitting this to their own family members? And the answer is yes. So they actually have to take that extra sacrifice to actually find the accommodation or find means to separate themselves from their own families. And you can imagine people who have spouses, who have small children, who may even have elderly family members in the same home, which is even more of a reason for them to separate themselves. So hospital actually provides accommodation for them if they have difficulty. But then again, the pressure, the emotional impact it has on the frontliner or the person who is affected by that, who's deemed high risk, is definitely there. And lastly, of course, I think not many people have spoken about this, but it's just a simple stigma of the disease. People know that it's just a viral illness, and then most people get better after it. But somehow, I don't know whether if it's our Asian upbringing or it's the way we view diseases. But what I've seen directly with my eyes is when people have been deemed high risk or have been infected with COVID-19 among the healthcare workers, they're very withdrawn, and they don't come across as being facing it head on. This level of self-blame, or even to the extent of guilt that they have when they carry it. I don't really know how to explain it, but I've come across somebody even mentioned this word because they feel that somebody is going to label them as pembawa COVID, and it's that simple guilty feeling, and it's not even due to their own fault, but if it's that fear of being labeled even as a COVID-19 carrier. So all this with the stress of just simply having to come into work and stay in layers of protective equipment throughout your entire shift, already having to deal with the heat and the sweat, and then on top of that, the risk of you contracting the disease and the implications on yourself, your family. I think the frontliners at the moment are under a tremendous amount of pressure. The hospital is trying the very best to provide all sorts of provisions for them. There's education about safety practices. There's a service for them to be assessed by the Occupational Safety and Health. And there's even a service by psychosocial support people from psychological medicine who comes and provides advice on how to, first of all, recognize if you're under pressure during this time. So we tell them, are you easily irritable, more than usual? Is your sleep affected? Is your appetite affected? Simple things like this. And we suggest to them, hey, you could be under a little bit of pressure from this, because not many people will come forward to say, I'm affected. Like I mentioned, they're withdrawn. There's this element of self-blame somehow, which I feel is so sad. And so we just come to them. We say, okay, so if you're feeling a little bit stressed, here's what you do. You can talk to people. You can focus on the positive things. There are certain things. There are certain people that you can talk to if you feel that you can't cope. That's the extent I feel, in summary, of the kind of work that we're doing in the front lines.
I see. Okay. Okay, you've covered a lot there. So I just want to start with.
Sorry, too much.
No, not to worry. So I'm very happy to know that that the hospitals have all these all these things figured out. Because my imagination is running wild, because I'm only thinking back to the those pandemic movies. Everything is overly dramatized. Those things like that. So very happy to know that hospitals like UMMC has preparations, precautions, and procedures to handle this for both the patients and the frontliners. Now, for the frontliners, I've seen pictures of them wearing the full PPE, the protective gear, the gown and the mask and all that. It looks pretty uncomfortable, because they have to wear those like hours and hours on end, right?
That's right. That's absolutely right. And it's mainly because we want to conserve. We don't want to encourage inappropriate use of our PPEs. And everyone's always worried that we're going to run out of PPEs, and that's one of the most disastrous things that can happen. I think it's very reassuring that the DG of Health is always reassuring the public that they're always sourcing for PPEs, and we always have about a week or two of supply always. That might sound a little bit alarming to people, that we only have a week or two supply of this or that, but that's how it has always worked. We always have to see what our consumption rate is or our burn rate is, and then we have to source for the appropriate materials from the appropriate sources. So rest assured, the hospitals and the government, I'm sure the ministry is looking into sourcing in whatever means that they can. So thankfully, I must say that we are quite comfortable with where our PPE supplies are at right now, at least at UMMC. Although we definitely appreciate additional contributions, so we will keep that in our reserve whenever the need arises. Coming back to how uncomfortable these PPEs are, so we want to conserve them. So that means we have to tell our staff when you're coming for work, if you are going to be assigned to a particular area, that area will have a designated requirement level of PPE, that you will need to don the level of PPE and only change the items which become contaminated. So the main things that we change very frequently are gloves, because that comes into contact with a lot of things, and also the plastic apron. Okay, so that's safe enough. So you will always see that gloves and plastic apron are changed in between patients, but the rest of the equipment, the mask, the shield, the gown, is there to protect the healthcare provider, so that one can remain on for the entire shift, so that you don't have to change that between every single patient. Can you imagine if that's the case? We'll run out of gowns much faster than we projected.
I see, I see. Okay. Well, yeah, good to know. Good to know that they've kind of all these PPE procedures planned.
Mm.
You also touched on something that's very, very, very important, which is I don't think that people really think about. Not only are these frontliners have to be prepared and not only protecting themselves for the sake of the patients, but they deal with this crisis in a psychological manner, which is kind of invisible because I don't think well, I've never really thought about it, so I'm sure now that you mention it, this must be really stressful and worrying because they have their own self and their own family to think about. So wow, just these people are these people are strong as steel.
I would have to say some of them definitely are. But I also would have to say that in the first few weeks of this happening, I could see that a lot of us in the front lines were just on the brink of tears on a daily basis. It didn't take much for someone to just start tearing or to start being visibly emotionally affected. It was to that level. A lot of people were making sacrifices already due to the MCO, having their families, their small children far away from them where it's safer, and them having to distance. Even sacrifices as simple as that were affecting people from very early on. So yeah, I commend them for still mustering the strength to come to work every day, because we know that we have a duty to serve, and we have the responsibility to care for and manage COVID-19 at the front lines.
Yeah, yeah.
But Justin, I must point out, us working in the emergency departments, yes, we're working in the at the front door, so to speak. We do our job, we recognize, we resuscitate, we optimize, and then we pass the patients on to the people who know best. And these are the people, the strong people who manage COVID-19 in the hospital. We call them the COVID team. They consist of our infectious disease doctors, our respiratory specialists, our internal medicine specialists, and of course our ICU, our intensivists, and our anesthesiologists, who all have a team of doctors and nurses who are rostered to handle this, all the COVID-19 patients. And they do the bulk of the work with regards to the long-term management of the patients. And as you can tell, some make it and some don't. And it's a very tough process for those people handling these patients on the ward. So yeah, it's not just the front lines that the people need to know about. I have to highlight there are a lot of backliners, sideliners, or whatever you want to call them. So there are people who are working very, very hard in our microbiology lab, who are processing the samples at a rate that they've never done before. They can go in excess of a few hundreds per day, depending on the traffic and the load. And they do their job very committedly as well. They know that they as well are exposed to the risk of infection because they are handling the samples. And not to mention the people who are also tasked with transporting the samples, our attendants who are bringing these high-risk samples from one place to another, our cleaners who are being called to come and clean the room after we've treated a COVID-19 patient.
Right.
They have to be properly educated as well. They need to know about the disease. They need to have proper PPE in order to come in and clean. The hospital management, who are not in the front lines, but they are the ones who are discussing this every single day. The task force and the COVID-19 task force of the hospital, and also the management of the hospital, who has to decide on a daily basis guidelines, policies, surveillance and enforcement strategy. So all the kind of things. So they're definitely not in the front lines, but you know what? They keep us all safe. They're the ones that keep things running, and we're holding the front. We're holding the fort in the front for them. We're doing our job as what's been tasked to us. But don't forget about the rest.
Right. Yeah. It really takes an army to run a hospital, especially during this time. So
it really is an eye opener, really, for a lot of people.
Yeah, yeah. There's a lot of invisible forces at work. So yeah, I guess we should be appreciating these people who are working behind the scenes as well, even though they're not dealing with the patients directly, but you know, they're also keeping the gears running, keeping the machine going on.
Definitely.
Yeah.
I do very much. I appreciate all the work that's been done.
Yeah. That's good. Good we have these people in our lives to help us there.